I'm Jenny. I'm 41 and I've been dealing with issues from Hashimotos for about 20 years. Mental clarity has gone away. Lots of brain fog over the years has gotten worse. And also about a year ago, I was kicked in the knee by a horse and also had a concussion from the fall. And with 2 treatments, I'm starting to already get better. When I went in for my knee, there wasn't much that they could do for me. They tried pain blocks that didn't work.
What kind of pain were you having in your knee after the horse kicked you?
A horrible pain. I've never experienced such pain in my life. I couldn't walk. I couldn't do much for a long time, and still a year later, I'm feeling very disabled.
Was it pain every day now?
Pain, always pain. Yeah, it's been.
What kind of level from 0 to 10?
Well, in the beginning, it was a 10 every day. It slowly went down to a 5 or a 6, and then I started just mentally living with the pain. And so I have to walk sideways up the steps to get up and down the steps.
Yeah.
And I can't do a lot of physical activity. So they really, when I went into the doctor, they didn't know what to do with me because nothing's broken, nothing's torn. So
yeah, like you said, you had pain blocks. What else did they give you?
That's all they really offered me. They didn't even offer me any pain medication. So it's been difficult, and I've had a hard time sleeping. I've tried a lot of natural methods that kind of take out some of the sting, but they really don't help.
Yeah. And so, how long have you been here now?
So I've been here for a couple of weeks and had some treatments with the pelotherapy and with QNRT and the quantum neurology, and I've experienced mental clarity that I can't remember the last time where I felt like that, and I'm feeling more empowered.
How old has been the last time you've had that mental clarity, you think? Before you're diagnosed, or how old were you?
Well, before I was diagnosed, probably in high school.
High school.
Okay. But I've been dealing with Hashimotos for half my life, and who knows how long before that I really had things going on. So it's pretty amazing that I can I feel like I can move more too, which is amazing. And after the QNRT, that I felt a release in my knee from other stuff. So
amazing, right?
It's kind of incredible.
So you're having that 5 or 6 out of 10, and now what do you have in the knee?
Now I'm like at a 3.
Like a 3?
So
fantastic
that's
change.
Really huge.
Yeah. So that's great in just in a couple visits or 2 weeks.
Yeah.
So, and then as far as the mental clarity, like this has just been a big change.
That's a huge change. Yeah. I haven't been able to remember things, and I feel more free in my mind. So.
All right. Well, thank you for sharing.
Yeah.
Hi, I'm Enid, and I've been coming here to functional medicine with Dr. Robert for probably, I think it was in May when I first walked through the door. And I came in with autoimmune issues such as cystitis, a bladder that was giving me trouble, finding out that I had leaky gut because things I was eating, they weren't agreeing with me, and the list was getting longer and longer of things I couldn't eat, and a lot of bloating, just not feeling good in my gut. I also had restless leg syndrome, which is hard to just sit for a while, or especially at night sleeping. I had to get up and walk around a lot. So things have been so much better. Dr. Robert put me on supplements for my gut, and with all the adjustments and other things that we've done here, I'm just feeling so much better. So much better that my youngest daughter is coming here, and I just scheduled an appointment for my husband, and so I'm just very, very happy to be here.
Could you comment on like what you experienced a little bit with QNRT? What differences would you say you've noticed happen?
Yes, QNRT. I just feel like I have been carrying around a lot of emotional baggage. Things that I didn't even know were there came out, and I just feel so much lighter, and I feel happier.
Yeah.
A lot happier.
And did other people notice?
Yes. My oldest daughter just said, "Mom, you just seem so much happier. What are you doing?" So, all in all, it's just been a wonderful experience.
All right. Well, thanks for sharing.
Hi, I'm Heidi, and I just wanted to tell you about some help that I've gotten from coming here with my psoriasis. So I've had psoriasis for like 30 years. I got it in my 20s, and so it wasn't as bad when I was young, but then when I had some deaths in the family, like 5 to 10 years ago, it really got bad, and I have it on my elbows, and I have it on my legs, and on my back. I have it just about everywhere. And coming in here, some of the treatments that I've been doing and the supplements and everything has, all of a sudden I'm starting to notice that's been clearing up, as well as some of the other things I had going on. Some of the things that I tried for my psoriasis, well, all the creams, all the lotions, all the light treatments, tar, coal tar, whatever. Of course, they always give you a bottle this big, and then you're supposed to use that. And when you have it all over your body, it doesn't work. I have tried some diets. I've tried different things like that. Nothing seemed to help, but came here for some other things like long COVID problems and other things, and it also, surprise, has been clearing up. So had it for 30 years, and actually
Is this the first time you've seen this clear up like this?
Yeah, it's just on its own. It's just going away. So not using any creams or anything. So
yeah, just getting
better. Just getting better. It's very hopeful.
Yeah.
I'm very hopeful.
How many weeks has it been?
6 weeks.
6 weeks.
6 weeks.
So
that I've been doing this.
Yeah. So all right. Well, thank you for sharing.
Hi, my name is Lynn Melhop, and I came in to see Dr. Robert because I had a burning mouth syndrome type of thing where my tongue and my lips would burn, and this had been happening for 6 to 8 weeks. Prior to that, I had a autoimmune disease going on, and I just didn't know where this burning mouth thing was going to be taking me, and I wanted to nip it. So I came in to see Dr. Roberts, and after my treatments with Dr. Roberts, I'm about 90% there, and doing really well.
Before coming in, the burning was constant, right?
Yep, the burning of my tongue and my lips, it was becoming pretty constant, and so it seemed like it wasn't necessarily food related, or it could have been, but it was a constant thing throughout the day. So even when I wasn't, triggering with food or drink, it was still happening. Yeah.
Are you noticing it daily now?
Really, I am not noticing it daily. There's a few things that will trigger it that Dr. Roberts has identified, but otherwise, if I stay away from dairy, for instance, and not all dairy, but certain dairies, I'm pretty good. I can go through a day without even noticing that I had this problem.
Nice. All right. Anything you want to add at all? Are you good?
No.
Matt Berg. I've been dealing with rheumatoid arthritis since 2013. I've been seeing a rheumatologist since about that time, and since that time I've been put on Humira, prednisone, Percocet, Vicodin, Tramadol, the list goes on. And things work for a week, and then they go south again. A lot of pain, numbness, just been getting really frustrated trying to figure out what I can do. I looked into switching my diet around, things like that, and I found this place, and
where were you having the pain?
the
numbness?
pains?
Where?
You know, my knees, my wrists, my neck, my back, pretty much everywhere. And what I would do is I would take the injections, I would take the prednisone, and that would just mask it, and I'd be able to go to work, and I'd be able to do 8 hours worth of work, and I'd come home and I'd be just exhausted, and I'd be in so much pain, I'd have to take more and more and more. And I just got really tired of doing that. Body started getting tired of doing that, emotionally and physically and everything. So,
What pain levels were you dealing with?
pain levels were day to day were probably, I'd say, 8 to 9. There's some days I couldn't even work. I couldn't walk, but I'd still go, and I would do what I could, but I'd have to go hide in my truck for a little while, and then just to get by. But yeah, the pain was just unbearable at times. So like I said, that's when I got into pain medication and different things like that, and got reliant on that. And
has it kind of stopped working, or you just,
Yeah.
what brought you in, I guess?
well, what brought me in is because my girlfriend and her family want me to get better. They know what they know how I used to feel, and I used to play basketball and run and swim and do all these things, and I can't do those now. And they wanted me to get back to that, so they tried to find different ways of getting me there. And one of them was your website and the medicine and treatment you offer. So, so
Okay, very good. Would you comment what kind of pain levels, where you had them today, and then this is like your first treatment, right?
Yeah. When I came in today, I was still experiencing the same pain I was when I saw you on Wednesday. Knees, just fingers, fingers, toes, and like I said, I had numbness. Just working with you for half hour, that stuff has dramatically dropped. I mean, I don't have the numbness right now. First time in, I'd say, a month. I don't have any numbness in my right hand. I have no pain in my right knee, no pain in my ankles, nothing right now. So
no pain.
None.
After wow, that's amazing.
It is.
Well, very good. Well, that's a great start.
Yes, I agree.
All right.
I'm Cardi, and I've been coming here since the 7th of July. And it's been 3 weeks working with Dr. DeYoung, and for the first time in years, I used to have what felt like an itchy sweater on that was just constantly picking here, picking there, which just makes you crazy making, and it's always in the background along with the stomach stuff. And I don't have any of that itchiness anymore. All that fog is gone because I can actually concentrate on what people are actually saying to me. For the first time, I've taken my grandkids to Lake Rebecca Reserve this afternoon, and I don't know, I'm just so happy and so thankful that I was led here, and this gentleman here is a gift.
Yeah, well, thank you for sharing. And so, like, night and day difference.
Oh,
what
night
percent
and day.
better is it?
Oh,
from
I
coming
would say 99. Maybe there's a little residual, and that might be just something because it's like I'm just have this maybe a little bit of fear that that it's going to come back as it has before, but it's probably 99.something% gone. I don't have any inclination to scratch.
Wow.
Which just, I don't know, I guess you don't realize that until you've had something taken away that's been so awful. But
yeah, how many years have you dealt with it, you think?
Since 2009. It's been not necessarily the itchy sweater, but dealing with different types of eczema because it morphs. I've had it where I've had to wear the mask over my mouth because I would scare people. My lips were swollen and yucky. I've had it so where it attacked my hands and in the inside of my elbows where it would be goopy and drippy. I've had it over my whole body. I've had it just on my neck and my chest. So it's like morphs into different places, but
yeah. And from how severe when you came in, and how severe you had it, to now, how happy are you with the treatments that have been done?
Just totally happy. Just totally happy with the treatments. I don't say that I necessarily understood what was going on, but I just trusted, and I felt like I could feel in my being that this was cooking something. I mean, I don't know. It just worked. I don't know how to explain it, but you don't have to understand it. Just do it. Just do the protocol. Just do what you're told to do, and it'll work.
Well, thank you for sharing. I'm
You're
sure
welcome.
anybody else who's suffering the way you did would be happy to hear there's hope. Things that can be done.
Absolutely.
Yeah.
Absolutely. I'm gonna, oh, and then I was gonna say on my last one that the reason I'm here is because of Western medicine doctor, Dr. St. Norris, advised me to go to try a functional medicine. But I don't think that you get, so anyway, I wanted to say that, so that's led me here.
You were gonna say that we're.
Well, I don't know. I don't know that. I would think most important for my benefit it was the QNRT.
Mm-hmm.
And I don't know that that's offered at every functional medicine place, so that's something to look forward to. You know, especially with when you're my age, because there's a lot of garbage there that you need to clear out first before you can heal.
Yeah, awesome. Well, thank you for sharing.
So I'm Jason Burke, new patient here, seeing Dr. Robert, Functional Medicine
Center, Minnesota.
Center of Minnesota, thank you. Wife found the place online. We've been searching for a while for some answers to a diagnosis I received about 4 years ago of Wagner's granulomatosis with polyangina. So it's a vascular autoimmune disorder that my own immune system was attacking myself. So I had lung infections, kidney infections, skin irritations, bone and joint pain. So Western medicine, I went to go Mayo Clinic, saved my life, thank you very much. They gave me what's called a Rituxan treatment, which is actually a chemotherapy type of drug for bloodborne leukemias, things of that nature was what I was on the understanding. That would take out my B cells. Not knowing what the outcome would be, body healed up. After about 14 months of that treatment, I started to get flares, and more I learn about this type of diseases, that's the way that it works. These flares will come and go, they'll continue on. So since then...
it would continue on for the rest of your life that way,
for the
correct?
rest of my life, yeah, I mean, I kept asking if this was something that was curable, and they wouldn't answer. They just said, we'll just have to see how it goes. Maybe we can reduce. It all depends on how your body, if it's going to reset itself, as if I could be rebooted by simply taking away a symptom. I was having less and less faith in that. It turned into annually, so the last 3 years after that, going back down and getting more rounds of this Rituxan. The other option was to be on prednisone, which also has got terrible side effects, and that didn't work out very well for me. So this time last year was my last Rituxan treatment. It was actually on St. Patrick's Day, as I remember. And this time this year, last month, I started noticing these trends again. Skin irritations were coming back. I had issues within my lungs where it feels like I almost have a broken rib. I don't really know what's going on, but the pain is sharp like that inside my lungs. So I've been searching, and knowing that, I wanted to try something else for a different type of medicine, a different answer. I've been looking in functional medicine, naturopathy medicines, something that was going to actually start to work on what's wrong with my system. Not let's just pull these symptoms away, what's actually causing this. And so realistically, I've been searching for a long time to be able to find those answers. I've been to other neuropathic, homeopathic, naturopaths, functional doctors in the past. Results varied, electrical currents, things of that nature, different supplements tried to be on. It never really stuck with me. Didn't really see many results. I've had acupuncture, didn't see many results. my wife turned me on to Dr. Robert, found the website online. I don't know how she did. I search all the time. So luckily she was able to find the website. Had a great conversation with Dr. Robert. He took time out of his day. I know that he was actually just leaving because he had left me a message stating that, but I caught him before he got out the door. He took his time with me. He answered all my questions and mentioned that what might be best is to come in for this a new patient kind of a review. We'll take a look at you. We'll do some tests. We'll see where we think that we can do. That was 2 weeks ago. The decision was made that very time, like, you know what, let's pursue this. This is the direction I want to go. I'm running short on time. I'm going to have to go down to Mayo if I don't do something. I know the way that this disease progresses and how fast it does. I don't need to get into another life-threatening situation. So in this time where my B cells are starting to return from the Rituxan treatment that I had, I wanted to be able to take advantage of what I could to be able to flush my system out. That's what I was thinking. And when I came in to talk to Dr. Robert, it was basically the same thing. He was talking about detoxifying the system, getting the leads out, getting any heavy metals out, anything that I had been exposed to in my entire life, emotional baggage, everything that was there. So it seemed like a really good fit. That's the direction that I wanted to be able to go in. Last week I had my first mud packing treatment, which I, although had done a lot of research, had never heard anything about.
Right. And it's to fix old physical injury, left over from old physical injuries on the body, and that block blood energy flow, that block your healing, basically.
Right. Which really seemed to coincide with what I was thinking was happening, kind of my inner self, just blockages, areas not performing right. I was almost a record-setting patient here. I got through a lot of the treatments. It was amazing how just putting mud on your body actually taxed your system. I mean, it really made me feel tired. I felt like I had a fantastic workout from sitting in a chair. So that was pretty cool. I was getting more and more energized as the day was going on. I know this is different for different people. People react differently for it. Sometimes you feel like you're completely wiped out, is what I heard. I didn't get any of that. I was excited. I was energetic. I felt fantastic. I went home. I felt great. I felt maybe a little bit fatigued that day. I mean, I fell asleep early, that's for sure. The next day, some mild soreness, but I felt, sounds funny, quote unquote, alive. I mean, I felt different than I had before. It wasn't anything that I had assumed that I was going to believe in, to be honest, but it did wonders. I was excited. I was exuberant. My attitude had changed. I knew it was a different direction. I started seeing physical differences, though, as well. I started noticing that on certain areas in my skin, which is part of what I was coming here for, lesions that would not heal, the redness was gone. They were starting to turn almost like it was a bruise, as if it's healing, and it was healing. A week later, I can barely see where those marks were. They hadn't healed in months.
Stuff that you've had for months.
For months, it just wouldn't heal. The only thing I was able to do was to go back on prednisone, which was preventing them from getting worse, but it wasn't really healing until one session of the mud packing treatment started. The redness was gone. They were actually healing. My lungs, the pain that I was feeling in my lungs, which I also had been taking the prednisone for as well, was gone. I didn't feel it anymore. That was last Wednesday. This is Thursday, so a week and a day later. Midweek, I actually tapered all the way off prednisone. I wasn't on that much, so it wasn't a big deal. I was on 20. That works for me. 10, I could still feel it, but after the treatments, I wasn't noticing it. I went down to 7.5. I forgot to take it because I was feeling well. I haven't had any for 4 days, so I'm back.
So the pain in the rib, that's gone. The
pain in the ribs are gone.
All it looks like open sores kind of in the blood vessels that you're having, all that redness. Like, was it bright red?
It was bright red.
Bright red.
Very irritated areas. They'd even be scaly. Now it just looks like a mild bruise, like it's just healing on my very white Minnesota pale winter skin. And there was an itch as well that has completely dissipated. My skin was feeling like it was on fire for the last month, which was really what precipitated me taking the prednisone because it was so annoying. Gone.
gone.
Oh God,
Wow. And that's just that one session, really.
that was just one
That one
session.
day. Yeah. So great. Anything else that?
No, just that I'm energized. I'm excited to be able to continue. There's more sessions. There's different things that we're working on. I'm excited to see how this impacts the things that are even deeper than just what I can feel, and maybe actually look at clearing my system out and not having to be able to go through these rituxan treatments. So that's the goal.
Absolutely. All right. Well, thank you very much, Jason. If anyone else was suffering with the same condition that you have been, what piece of advice would you give them?
I would definitely look into this. I mean, the autoimmune disorders and the way that they're treating them is basically just taking away symptoms or taking away your immune system, which is what they were doing in my case. I had to be on antibiotic for the last 4 years. That wasn't anything that I wanted to be on. In today's day and age, it's about probiotics, it's about evening things out. A leaky gut is nowhere you want to be, and everything and all the treatments that I was giving me that as well. So,
And we're addressing all those issues to help you heal from that too.
yes.
Currently. Yeah.
Yes.
Very
So,
good. Okay. Well, thank you for your talk and time.
Thank you. Appreciate it.